I'm Melissa Bailar. I'm the Executive Director of the Medical Humanities Research Institute here at Rice University. MHRI was founded in 2023, so we're a new institute here at Rice, and we have been really busy already. We are so excited that Rice has recognized the value of medical humanities, of focusing on the humans at the center of healthcare, both patients and providers alike. We are focused predominantly on translational research, so that's research that can actually be applied in clinical settings. We have several programs that are designed with our undergraduates and some with our graduates in mind. We have a thriving medical humanities program which houses our minor in medical humanities, and it draws in a lot of the pre-health professions students. Through MHRI, however, we get to connect students with active research in medicine, bringing their humanities perspectives and skills into applied research. So, for example, they are able to bring in skills that they gather from their literature and medicine class on analyzing texts. They're able to bring in perspectives from the anthropology and medicine classes where they focus on individual patient experiences. We have a few programs. So one is our research practicum, which is required for the minor in medical humanities. Another is paid research assistantships, in which students are plugged into an ongoing research project in the Texas Medical Center. We are also establishing chain fellowships, so for students to be involved in our new center on humanities-based AI innovation. And we're recruiting for those students right now, so I'm excited to see our new cohort. And then we have a couple of things in production as well. We are working towards a post-baccalaureate program for students who are taking a gap year before going on to medical school or public health school or nursing school. And we're developing a graduate student summer internship program. We have a few great examples of the ways that students have learned about medical research and the human side of it through MHRI, but that also has really benefited our research collaborators in the Texas Medical Center and beyond. One example is we have a research partnership with Taipei General Veterans Hospital in Taiwan, and they're very interested in our expertise on patient perspectives in healthcare innovation. So we were developing some research collaborations with them. Then we connected with the Rice in Country program, and we established a track for our medical humanities students to join that research team at the hospital in Taipei, get involved in some of the research, shadow their physicians, talk with their medical students. That's been a really productive collaboration that we're growing currently. And we also have many of our students working across the street with Texas Medical Center. One example is a project on pain management, sedation, delirium, and withdrawal symptoms from pediatric patients in intensive care settings. So we've had a couple of students involved with the research team at Texas Children's Hospital. They provided a lot of great insights. The team was really excited about the work that they were doing. And now there is a joint publication coming out of that, and we were putting in for some grant proposals to expand the work on a much larger scale. We have a lot of students who are very well rooted in the sciences. And through the medical humanities, we introduce them to a variety of different perspectives. We have courses and research opportunities in many different disciplines, and these students are able to bring the knowledge, the perspectives, the methods and the questions that these different disciplines ask about health, illness, care, cure. So for example, students who are interested in taking some classes or joining research projects that are rooted in ethnography, they can bring what they learn about listening to individuals, going in depth on their experiences, and understanding the myriad effects that health and disease have on a person into their future interests in medicine and public health. So they are able to focus more on the individual patient, not only on the science. Similarly, our students who are interested in literature, they can bring their skills in close reading and analysis to understand the ways that technology marketing organizations might be using persuasive rhetoric, or they can listen to a patient talking and understand not only what they're saying, but also how they're saying it and how that affects the meaning that they're conveying. Students who are interested in history, they're able to benefit from seeing how our past practices are informing our current models for care and discovery. So some of our past in medicine is not very admirable. And it's important for students to know that in order to understand why healthcare is not always trustworthy. Students who are interested in religion and spirituality can bring perspectives from that discipline into understanding what patients need, what kind of support they need emotionally and spiritually when they're in times of crisis. So overall, our interdisciplinary approach gives students a whole new toolbox of perspectives, of questions, and of methods to bring to medicine and healthcare. We're doing a lot of research at this point, and I'm excited to see this research actually put into action in making healthcare more equitable and accessible for all, and really recentering care around the people who are involved, whether that's the patients, family caregivers, clinicians, or team that is necessary for taking care of people. So some other things that I envision that we will be doing in the next few years are really expanding our international reach. We have been contacted by potential collaborators and colleagues all over the world, and a lot of those partnerships are really growing. For example, we've had an ongoing collaboration since we were founded with colleagues in Paris Sciences et Lettres, PSL. And we've now had a workshop with them. We are hosting a delegation from PSL here in Houston, and we're looking into possible partnerships and exchanges for faculty and students. So I really see our international collaboration strengthening in the short term. Chain, I'm excited about as well. That center, that's really solidifying a great partnership with Bailar College of Medicine, as well as with innovators in the Texas Medical Center. And I see this really getting younger researchers, students, junior faculty at both institutions involved in thinking about how to make health AI trustworthy. So not just trusted, but really to make sure that it is not perpetuating bias, that it is promoting equity and accessibility. I see us getting more involved in training. We're working on developing a graduate certificate program for students here at Rice. There's been quite a bit of interest in that, but also training programs in the Texas Medical Center, We have a lot of expressions of interest in learning more about medical humanities, and not just on a theoretical level, but also thinking about how do you set up a collaborative research project? What does research look like? What does it need? What does it entail when it's coming from a humanities focus? We're establishing training for medical professionals too. We have a clinical fellowship program already established, and we're about to onboard our second fellow. Those have been really key in allowing us to collaborate, to form new connections, to provide more opportunities for students. And I'm also excited, we had a medical fellow reach out to us recently who is going to do a rotation with us at MHRI. So this is new territory, thinking about a rotation not in a particular disease-focused area or particular medical specialty area, but rather thinking about rotations through a humanities lens and those types of skills and questions. In the next couple of years, I also see MHRI really strengthening our position here at Rice as the premier place for medical humanities research. There are many different programs nationally and some internationally that focus on medical humanities education, especially education in medical schools, but very few that really focus on research, much less applied research in medical humanities. So we already are standing out as unique in that respect, and I imagine that over the next couple of years, we're just going to keep growing in our reputation and in bringing attention to Rice as the place for medical humanities research. MHRI remains responsive to emerging health challenges through a variety of different ways. One is through engaging with faculty across schools and across departments here at Rice. We have connections with over 16 departments now, and having those interdisciplinary perspectives keeps us on our toes about what is going on, what's current, what's new in different fields related to health and medicine. We also maintain our focus on research collaborations, which also help us to see what is happening on the ground in healthcare. What are the emerging concerns that clinicians and patients face? So engaging in those types of collaborations also positions us to engage in meaningful research in tackling current challenges. We also are involved in changing medical culture as well through various collaborations and training programs. So engaging with the new generation of healthcare practitioners and leaders, as well as those focused in the humanities who are interested in medicine too. Staying up to date through our connections with junior members is really key as well. I was really excited when MHRI was first established a couple of years ago at the number of people reaching out to us, wanting to collaborate, wanting to learn more. We had worked a long time on putting together a proposal and a structure for the Institute. And we have a long-standing undergraduate program in medical humanities. But once we became an institute, people from across the Texas Medical Center, from across the US and internationally all started reaching out. So I think a surprising moment was the increase in the volume of emails, but in a very exciting way because it meant that we could really increase our networks and collaborations. I'm also really excited about the range of people who have been reaching out to us, from artists who are interested in getting the arts more involved in healthcare, to policymakers who are looking to medical humanities perspectives, make meaningful arguments about improving health equity and access, to clinicians who are concerned about the experiences that their individual patients are having, are looking to find renewed meaning in their work, especially as There's more and more automation and technology involved. Humanities scholars who are really interested in thinking about illness from a variety of disciplinary perspectives, and to patient advocates who already know the importance of the individual experience and are looking for ways to get patient voices heard and in the room with decision makers. So having these range of people that are excited about MHRI and the work we're doing makes our job really exciting too.